Zenko was born in August 2007. He developed normally as a child, met all the milestones as required. He began using words by the age of 14 months. By the age of 18 months, he started to lose his words gradually over time. But it was over months, the words just started disappearing, and he just began to make childlike noises. As Zenko is now completely non-verbal, he makes noises and sounds, but he has no words whatsoever. I brought it to the attention of the health visitors at his 2-year checkup, as I was particularly concerned because I didn't think he was developing as he should be. And eventually Zenko was referred to the Child Development Centre at St Luke's Hospital, and they carried out a JAX assessment to find that indeed Zenko was autistic, and he was diagnosed in February of this year. Thankfully, through the speech and language department, we were able to get his diagnosis quite quickly because they were the ones who actually referred us to the Child Development Centre. So Zenko was diagnosed within 6 months, and he continues to work now with the speech and language department.
I work with children with autistic spectrum disorders from early years up until 19 years of age. I work as part of a multidisciplinary team, so that might involve clinical psychologists, educational psychologists, paediatricians, specialist teachers, parents, which are a really important part of the team. Could involve nursery teachers, school teachers, health visitors, I suppose anybody really that's involved with the child and their family. The referrals can come in from a variety of different sources. They might come in from parents, parents can refer directly. They might come in from a health visitor or a paediatrician. Sometimes we get referrals in from nurseries or children's centres. So it's an open referral system. As long as we've got consent from parents, then lots of different people can refer. I would be involved with children sometimes before they've actually had a diagnosis, so pre-assessment, pre-diagnosis, and then I see children as part of a multidisciplinary assessment process, which involves a clinical psychologist, paediatrician, speech and language therapist, and other people who might be involved with that child. And then I might meet with parents with one of the other professionals and feedback to the parents the outcome of that assessment.
They initially came to our house and carried out an assessment with Zenko, again through play, eye contact, to see how he would respond. When he started nursery, the speech-language therapist went into school and she observed how Zenko behaved around the other children, and initially he wouldn't really play alongside them. He'd keep himself in a corner somewhere and he'd do his own thing. But she's developed strategies alongside the teachers to help integrate Zenko into group activities, and they have managed to increase his eye contact levels, so now that when he's spoken to, he actually looks at you, which is something that he very rarely used to do. So he actually looks at you, he listens, and he's able, in his own way, to communicate his needs. And gradually, over the months, Zenko has responded really well, and he is now able to join in with games. He's able to clap and be happy when all the rest of them are singing. He can sit in assemblies at school, which is something he would never ever tolerate before. And by the end of term, after a year at nursery, with the work of the speech-language therapist and the teachers, he can now sit through an entire assembly. It's amazing.
Intervention that we give can often help with behavioural difficulties. A lot of the children that we would see can often get very frustrated because they either can't understand what's happening around them or they're not able to get their messages across. So if we can put strategies and systems in place that can help with that communication process, then you often find it has a knock-on effect, a positive effect on the behaviour. As well as the multidisciplinary team, I see parents to support them with understanding the child's diagnosis. and explaining perhaps what that means and helping them to understand the diagnosis, but also how that's going to affect the child, and also how they can perhaps change what they're doing at home or modify what they're doing to support the child's communication. And because the parents are with the child the majority of the time, they're a really important group of people to work with that child. And it's really important as well that parents can contribute to the child and the input that they're having, so that they can make informed choices about appropriate places for the child. So whether it's nursery, school, mainstream school, specialist provision, parents are really key to that decision-making process.
What I find really, really reassuring is that the speech and language therapist, after she has made a visit to school, not only does she speak to the teachers and help them, because Zenko is the only autistic child in the class, so she gives them techniques to work with so that when she visits next month they can progress to something else. But then after that she always rings me that same day to give me an update of how Zenko has progressed, what areas she thinks we need to continue to work in, and what we can do to help him at home as well as at school. And the speech therapy department have given us a list of various scenarios that we can use at home to try and bring him out of himself a little bit.
Early intervention is really important. We would go in and see children in nursery, and sometimes we see them before they're in a setting. And just if you can put those foundations of communication in place, then that helps the child all through life. And we also support children with transition, so it might be transition from nursery, from preschool into school, into full-time education, and we can support with that process.
They're constantly there. If I've got a problem or an issue, I can phone them and they will come and make a home visit, or they will make an extra visit to school if the school feels that they need extra help. And Zenko is definitely coming along, I'm happy to say.
Speech and language therapists just have such a positive impact on the child's life, but also on the family and on the nursery, on school. You know, and we can support children to access all the things that perhaps they might not be able to access. Things like the education, the recreation, all the social activities, and also to be a part of the community that they live in.
Such a short time, it's unbelievable, really is. And I think, you know, without the speech therapist's input, I don't think we would have got that far, especially with Zenko being in a mainstream setting where all the other children don't have any difficulties like Zenko does. With the help of the speech therapy department, I don't know, I just feel so lucky that we were diagnosed so quickly thanks to them. And with their continued support, I'm just looking forward to see what the next 12 months bring.